LifeAire Systems was designed in response to an absence of a solution after we learned the significance of air quality on patient care. Much to our surprise, there was nothing commercially available to deliver the airborne metrics we knew were so critical to our success and to the delivery of the highest level of patient care. Once we realized these metrics, we literally worked backwards and designed a system that would deliver those metrics without producing byproducts and would do so in a single pass of air. And what I mean by that is any infectious bacteria, viruses, or fungi that enter the system will not exit. Whereas a lot of technologies, the air needs to go through 5, 10, 20, 30 times. So that was very important to us.
We were fortunate to collaborate with LifeAire on a clinical study. The initial series of studies showed that LifeAire effectively eliminates a lot of the contaminants, bacteria, viruses, fungi from the air and by proxy from surfaces around patient rooms and the hospital. The second study actually looked at how this might affect patient outcomes. And what we found is that patients were able to go home sooner and they overall did better.
It's already been demonstrated in a study involving over 8,000 adult med-surg patients, now published in a peer-reviewed healthcare journal, that by removing all airborne infectious pathogens and dramatically reducing surface, that the length of stay was decreased by 39%. It also demonstrated a reduction in HAIs, or healthcare-acquired infections, and improved discharge outcomes and significant cost savings. In a second clinical study that we've conducted, the staff illness was dramatically reduced and staff call-outs were dramatically reduced. So you're really sending a very strong message of protection, not only for the patients, but also for the staff.
I believe that we have a solid foundation for future growth. Together, we've been able to create a lot of opportunities to improve patient care. And I think this is only likely to grow. We hope to be doing more research with LifeAire because there are many, many questions that remain to be answered in this important area. It's really a brand new area of research. No one's ever looked at quality of air in hospitals, unless it was something really bad. Now we're looking at taking good to great, and I think that's what LifeAire's all about.
Of course, our goal is to make the St. Luke's Carbon Campus one of the safest hospitals in the country. LifeAire is certainly consistent with that theme. LifeAire, it's not just an air filtration system. It kills COVID. It kills other viruses. It kills other pathogens in the air. And we'll have the presence of this miraculous technology throughout all patient care areas. It's incredible.
I'm Kathryn C. Worrilow, founder and CEO of LifeAire Systems. It's really an honor to participate not only in this great event of celebration, but also in the vision of excellence across all sectors of patient care associated with one of the most innovative and forward-thinking hospitals, St. Luke's Carbon County. Our vision at LifeAire Systems began well over 20 years ago when we realized the significance of airborne bacteria, viruses, mold, and chemical pathogens on the successful growth of the human embryo during in vitro fertilization. I was literally given a blank check, the only one of my life, by our administration, specifically to purchase an in-duct, in other words, in the duct above the ceiling or on the rooftop, an in-duct air purification system that would deliver the air quality we had learned over a 15-year period of intensive research, the air quality that we now knew was so critical to the level of patient care that we could offer. I was shocked. I couldn't use the check. There was nothing I could commercially purchase as a clinical provider that would adequately protect our clinical space from airborne pathogens. This was personally and professionally unacceptable. The level of care that we could offer our patients was dramatically and negatively impacted by something we couldn't even see, the air and its complex components. The absence of a solution to purify the air to the point we now knew we needed for optimal patient care. The absence of a solution led to the genesis of the LifeAire system, a transformational air purification system that destroys. It doesn't capture, it doesn't filter, it destroys and removes all infectious airborne bacteria, viruses, fungi or mold, and chemical pathogens. Because the system's technology was originally designed to protect the human embryo, the bar, the design bar, if you will, was set extraordinarily high, the results of which are now offering a paradigm shift in air purification in the healthcare setting. Alice, next slide, please. Technology overview. The technology is purposed, it's proven, and it's patented. What makes the technology unique is that it delivers comprehensive destruction or removal, again, of all infectious airborne bacteria, viruses, mold, and chemical pathogens. But it does so on a single pass. It was critical that what entered our system infectious was destroyed and did not enter the clinical spaces being protected. Secondly, we chose the anthrax spore as our target for destruction, not because we were concerned with anthrax, but because it is the most difficult biological to kill. Again, the bar was set very high. So as the kill effectiveness was actually tested by the National Homeland Security Research Center, and because our system delivers an anthrax kill, it actually provides what's referred to as a 9-log remediation. 6 log is sterility, so 3 logs more aggressive than sterility. A 9-log remediation of all other infectious bacteria, viruses, and fungi that do concern us in healthcare, including but not limited to C. diff, MRSA, pneumonia, influenza, staph, strep, and absolutely COVID-19 and its variants. We wanted this protection to be delivered 24/7 during live operation within the clinical spaces, no matter what the activities were in that space. And finally, it was critical to us that the technology deliver this excellence without producing byproducts, and that the system be supported by multiple robust clinical studies. We are very proud to be an evidence-based technology company and within the Lehigh Valley. Alice, next slide, please. The combination of what our technology delivers, the comprehensive destruction of all infectious pathogens in the air, and the fact that of those pathogens that cause healthcare acquired illness or infection, of those pathogens that cause these infections, 69 to 80% are airborne. 69 to 80%. Fact number 2, of the infectious pathogens on the surfaces, your bedside table, the counter in the patient room, 90% originate from the air. Now, healthcare-acquired infections represent a significant clinical and economic issue in our healthcare system within the United States. So the combination of a technology that offers a paradigm shift in air purification and the persistence of healthcare-acquired illness and infections led to multiple large clinical studies. Next slide, please, Alice. One of which was conducted with St. Luke's, to which Dr. Stawicki referred, where clinical outcomes were compared between 2 floors at full patient capacity. And as stated, over 8,300 adult patients were included in these studies. The studies compared one clinical floor protected by traditional HEPA filtration, to a second clinical floor protected by the LifeAire technology. The results were both statistically significant and offered a paradigm shift in the significance of the air surrounding our clinical areas, patients, visitors, procedures. Next slide, please. Monthly environmental testing of the air and of the most commonly touched surfaces within each patient room, occupied, operational patient room, over a 12 and 15-month period in each of 2 independent studies, demonstrated that the patient rooms protected by the LifeAire technology demonstrated greater than a 99% decrease in airborne bacterial, viral, and fungal loading, and a 97% decrease in infectious surface loading. Again, 90% of what lands on the surface originates from the air. By removing all infectious airborne pathogens during live operation, this is key, patients, staff, visitors shedding viral particles by breathing, talking, sneezing, coughing, flushing, singing if the moment strikes. By removing all infectious airborne pathogens and dramatically reducing infectious surface pathogens, 2 very common sources or vectors of illness were removed or reduced. The results of which included, next slide, please, a trending reduction in healthcare-acquired illness and infection, as well as readmission rates, a statistically significant improvement in patient discharge outcomes to their homes, and a 39% reduction in length of stay. Patients were going home sooner, which drove a cost savings of 23% to the hospital. Next slide, please. In addition to the significant clinical and economic impact, there was also the high level of comfort and confidence, knowing that the patients, the staff, and the visitors specific to the floor protected by the LifeAire technology were also being protected from both common and new infectious airborne viruses. Again, as the system was designed and proven to kill the anthrax spore, it provides an exceptionally high level of kill towards the more common bacteria, viruses, and mold with which we are concerned. Next slide, please. We are honored that this purposed and proven technology has been installed and is now operational to protect your ORs. Next slide. Your PACU. Next slide. Medical surgical floor. Next slide. And your intensive care unit at the St. Luke's Carbon campus. Again, the installation of the LifeAire technology is consistent with the innovative vision towards excellence in patient care, as clearly demonstrated by the clinical providers, staff, engineers, project managers, and leaders at St. Luke's. Next slide, please. St. Luke's is not only the first in our great state of Pennsylvania, but is completely unique in that it has chosen to protect all acute care areas in its Carbon County Hospital and joins other leading healthcare providers in the United States in offering a transformational technology that impacts care across a continuum. Next slide, please. Across a continuum, beginning with our genesis and absolute determination to protect the human embryo, to the reduction in infections, readmission, and length of stay in the acute care setting, and finally to the reduction of illness and infections towards improved quality of life and wellness in senior living. We are honored to both impact patient care and wellness across a continuum of care, as well as be part of one of the most innovative and forward-thinking hospitals in our region our state, and our country. Here for only one reason: to serve each of you in Carbon County. I thank you.